Claim denied. 3 words that trigger financial headaches for hospitals and often trace back to the clinical floor. Claim denials cost billions, delay payments, and drain resources. But what if many are preventable? Were you, as a nurse, ever truly trained to understand denials management or how your notes impact payment? You meticulously provide care, but does your nursing documentation effectively prove medical necessity and completeness to satisfy payers? Or are gaps in charting inadvertently opening the door for RCM roadblocks and lost hospital revenue? It's time to stop seeing denials as someone else's problem and start seeing your power to prevent them. Welcome back to the Healthcare Nurses Network and Nurses Link Up mobile app podcast series. This is Breaking the Code, Nurses Unlocking Revenue Cycle Management. This series is your essential guide, delivering the financial knowledge you deserve to navigate the full healthcare landscape effectively. In Episode 7, we dive deep into Understanding Denials Management and Nursing's Role in Reducing Denials, written by Dr. Nicholas Abella. You'll discover why claims fail, unpacking the top reasons for claim denials, including insufficient documentation, coding support errors, and failure to prove medical necessity. Your critical role: how precise, timely, and justification-rich nursing documentation is the ultimate denial prevention strategy. Denial-proof your charting, actionable techniques to ensure your notes clearly support the care provided and meet payer requirements, safeguarding hospital revenue. Guiding you through these essential strategies are your hosts, ICU nurse James Carter, BSN, RN, and nurse manager Emily Ramirez, MSN, RN. Get ready to break the code. Your RCM transformation starts right now.
Hey everyone, and welcome back to the Healthcare Nurses Network podcast. We're all about giving you the insights and real-world strategies you need to really thrive as nurses.
And today we're tackling something that honestly might not sound super exciting at first glance.
Yeah, like at first you might be like, denials management, what does that even have to do with me?
Right, but trust us, this is something that has a way bigger impact on your hospital, and guess what, on your patients too, than you might realize.
It really is like unlocking some kind of hidden potential.
Absolutely.
To give you the best possible care.
So for this, we've been poring over this document, and it is packed with insights.
RCM.
Yeah, RCM, which stands for Revenue Cycle Management.
And essentially,
it's the whole process of how hospitals actually get paid for all the amazing care that you provide.
it's like the financial backbone of the whole system.
Right, and what we're focusing on is understanding why claim denials happen in the first place.
And more importantly.
Yes, much
Right.
more importantly, what you as nurses can do to prevent them.
So mission number 1 is to figure out why these denials happen.
Crack the code.
Grab the code.
Yeah.
But mission number 2, the one we're really excited about, is showing you how your everyday work life, the stuff you do meticulously day in and day out, is actually the key to stopping these financial leaks.
Because the reality is when those claims get denied, it creates a real ripple effect.
Yep, it's not just a number on a spreadsheet.
No, it impacts your hospital's revenue, and that directly affects their ability to invest in the resources you need to give your patients the best care.
We're talking about things like new equipment,
Yeah.
the latest technology.
Adequate staffing levels.
Exactly, making sure there are enough nurses on each shift.
And what our source really drives home is that the way we traditionally think about this whole billing process often misses a crucial link.
What's that?
Your documentation.
No.
The detailed notes you take every single day as nurses.
It's like the foundation.
Exactly. It's the foundation for a successful claim. And if that foundation's shaky, if it's missing details or isn't clear enough, well, the whole thing can crumble.
It makes sense if you think about it. If the insurance company doesn't understand why a treatment was necessary,
They're not going to pay for it.
they're not going to pay for it.
So let's get specific.
Let's do it.
What are some of the top reasons these claims get denied?
Give us the dirt.
Okay. One of the biggest culprits is incomplete or insufficient documentation.
Oh, documentation strikes again.
It's like telling half a story, right? The payer, they don't have all the pieces to understand why a service was necessary.
Okay, so say you gave a patient a specific medication. It's not enough to just write down that you gave it to them.
Right. You mean why?
The why.
Mm.
Why did this patient need this particular medication?
Our source has a great example from the Centers for Medicare and Medicaid Services, or CMS. Let's say a patient has signs of an infection, maybe a fever, and a high white blood cell count.
Right, those classic signs.
Documenting those specific findings, that's what justifies the treatment because it paints the whole clinical picture.
It's all about connecting those dots.
It really is.
So the insurance company can see the whole story. Another area where your documentation is crucial, and I know this might sound a little intimidating, but it's medical coding.
The good news is you don't have to be a coding expert, but your documentation is what those coding teams rely on to assign the correct codes for the diagnoses and the procedures.
And if what you write isn't clear enough.
If it's vague.
If it's vague, it's almost like you're giving them a blurry photograph.
It's hard to make out what's going on.
And blurry photos lead to mistakes, right?
Absolutely. They lead to coding errors and then boom.
Denied.
Denied.
Our source, Health Catalyst, has a great example here. Instead of simply charting wound care provided, what could you write to give those coders a much clearer picture?
Much more specific. How about this wound debridement performed with sterile technique per doctor's orders?
Okay, now that is precise. And that precision is what can really make a difference.
It's not just about what you did, though. It's also about making sure you're crystal clear about why it was medically necessary.
Yes, medical necessity.
The golden phrase.
The golden phrase, because sometimes insurers will deny claims if they think a treatment or service wasn't actually medically necessary.
And that's where your documentation becomes your advocate.
Speaking of advocates, I love this example from the Health Information Management Staff Transformation Toolkit. Say a patient needs oxygen therapy.
A common scenario.
Right, instead of just documenting the oxygen flow rate.
Which is important, of course.
Of course. But go a step further and add in why it was needed clinically.
Give them the reason.
So you could say something like, patient exhibited oxygen saturation levels below 90%, requiring supplemental oxygen per doctor's orders.
Boom, medical necessity established.
Right there on the chart. Now, this whole idea of medical necessity doesn't stop with the initial treatment either.
Oh, you're so right.
Follow-up care, that's where it really comes into play.
We were reading this article from Revenue Cycle Home Health Insight, and it reminded us that documenting those follow-up details, what happens after that initial visit,
The aftercare.
it's essential for showing that ongoing care is still medically necessary.
So are we talking about things like patient education?
Absolutely.
Like, did you teach them how to care for a wound at home?
Did they understand those instructions?
And how did the patient respond to the initial treatment?
It's all about demonstrating that continuity of care. So you might chart something like, patient instructed on wound care and signs of infection to monitor at home.
That shows you're not just treating the immediate problem, but you're thinking long-term.
Thinking holistically.
Thinking holistically about their well-being.
Now, let's switch gears for a second and talk about something that might seem a little more on the administrative side, but trust me, this is a game changer.
Hit me with it.
Standardized templates.
Ah, yes, those trusty templates.
I know it might sound a bit boring, but honestly,
They're your friend.
they are your friend. The AAPC Knowledge Center makes a great point about this. Templates are designed to make sure you're capturing all the essential information in a structured way every single time.
It's like having a checklist.
It is a checklist, and when those templates aren't used consistently, that's when things get missed.
Important details slip through the cracks.
And claims get denied. But using those templates, whether it's for a specific procedure or for managing a chronic condition,
Helps you cover all your bases.
every single time. So we've covered the why behind denials and how your documentation is really your secret weapon in preventing them.
Right, because it's not just about paperwork. It's about advocating for your patients.
100%.
But let's get practical. What can nurses do starting today to really make a difference?
Okay, first things first, take advantage of any documentation training that your hospital offers.
Yes, knowledge is power.
It's true. The rules and the requirements from insurance companies, those are constantly changing, so staying up to date is essential.
Our source, Frost & Sullivan, really emphasizes the importance of ongoing education here. It's like you're getting a cheat sheet.
Think of it as a refresher course for your documentation superpowers. Now, another really actionable step is to embrace real-time charting.
Charting as you go.
As you go.
Why is that so important?
Because it minimizes the chances of forgetting those crucial details later on when you're trying to remember everything that happened during a busy shift.
Right, it's fresh in your mind.
Exactly. Like our source gave the example of documenting medication administration and the patient's response right away.
Okay, so you could write something like this. Administered 500 milligrams of acetaminophen at 10:00 a.m. Patient reported reduced pain within 30 minutes.
Perfect. That's concise and accurate.
And here's something that might not be on everyone's radar, but is so important: connect with your coding team.
Yes. Build those relationships.
Because they're not some mysterious entity in the basement.
They're your partners.
They're your partners.
Communicating regularly between nursing staff and the coding team can really bridge that gap between the clinical world and those billing requirements.
It's all about teamwork. And our source suggests having those regular meetings, maybe once a month, to review any cases where documentation issues might have led to denials.
Share best practices, create some checklists together.
Make it a collaborative effort. Now let's zoom out for a minute and talk about what hospitals and nurse leaders can do to really cultivate a culture of denial prevention.
Because it's not just about individual effort, right?
Exactly. It's got to be a team effort.
One powerful strategy is to regularly analyze those common reasons for denials.
Okay, so work with your billing department. Figure out what those recurring problems are.
And then target your education and your documentation improvement efforts accordingly.
So if you see a pattern like insufficient documentation of medical necessity popping up again and again,
that's your signal.
That's your signal to focus on really nailing that clinical justification in your notes.
Exactly. And always include those detailed justifications.
Instead of just saying IV intervention.
Explain why it was necessary.
Say something like, patient presented with severe pain, unresponsive to oral medication, requiring IV intervention.
Boom, context provided.
And of course, we have to mention those standardized templates again.
Our trusty friends.
They really are your secret weapon for consistency and completeness.
Think of them as a safety net to make sure you're capturing everything you need for different types of care.
Like a wound care template.
Exactly.
It prompts you to include all those essential details.
Now, don't forget about documenting those follow-up actions thoroughly, too.
Right, because that shows you're not just putting a Band-Aid on the problem.
You're thinking ahead.
You're thinking ahead. You're providing comprehensive care.
You're educating the patient. You're planning for their ongoing needs, and that demonstrates medical necessity.
So, for instance, you could chart something like patient educated on post-discharge care instructions and signs of potential complications such as increased swelling or redness.
That tells the whole story.
Now, I know some nurses might be thinking, okay, this all sounds great, but am I really going to have time for all this detailed documentation? I'm already so busy.
It's a valid concern.
It is. And our source actually addresses this head on. While it might feel like more work up front, consistently charting in real time and using those templates can actually save you time in the long run.
How so?
Because you're less likely to have to go back and try to remember those details later.
Oh, I see.
Or deal with the back and forth of trying to get a claim paid.
So it's an investment.
It is an investment in efficiency.
And remember, all this meticulous documentation isn't just about avoiding denials.
Right. It's about something much bigger.
It's about making sure that patient's medical record is accurate and complete, which ultimately leads to better patient care.
Exactly, because when you have a clear picture of everything that's happened during a patient's care,
it means better communication between all the healthcare providers involved.
And that leads to more informed decisions about their treatment.
So your thoroughness, it really does have a direct impact on patient outcomes.
And here's the thing that I find so empowering. We as nurses, we're not just bystanders in this whole process.
We're not just watching the financial side of things happen from the sidelines.
We are active participants.
We are essential players in the financial health of our hospitals.
And by really understanding these principles of denials prevention
and committing to excellence in our documentation,
we can make a real difference, not just for the bottom line,
but for the quality of care that we provide to our patients.
Wow, this has been such an eye-opening into denials management.
I agree.
And I hope this has given everyone listening some really concrete strategies that you can start using right away.
Absolutely.
Now, if you're hungry for more resources or you want to connect with a community of awesome nurses who are passionate about this stuff,
head over to healthcarenurses.net.
It's a fantastic online hub where you can share knowledge and learn from each other.
It's a great place to connect. You can also download our Nurses Link Up app.
It's available on both the Apple App Store and the Google Play Store.
And it gives you tons of valuable networking opportunities, plus a wealth of information right at your fingertips.
We highly recommend checking it out.
So here's a question for all of you listening. What's one small change you could make in your documentation habits starting today?
Just one small tweak.
That could have a ripple effect and contribute to a big positive impact, both on your hospital's financial health.
And of course, most importantly, on the amazing care you provide to your patients. Think about it.
That's all for today.
Thank you for listening to the Healthcare Nurses Network podcast.